Chapter 1. Post or no post. Keys to decision making. Restorability and ferrule. If at least 3 to 4 intact walls remain with a continuous ferrule greater than 2 mm, the tooth may be restored with a bonded core and full coverage crown without a post. Studies show that even a partial ferrule is much better than none, and lack of ferrule greatly increases the fracture risk. If greater than 3 walls and a ferrule exist, a strong bond often retains the crown without extra post. If less than 2 walls or no ferrule, a post is usually indicated for retention. Remember, ferrule can be gained via crown lengthening or orthodontic extrusion if feasible. In severe cases with no ferrule on an anterior or a premolar, consider alternatives like forced eruption or endocrowns, which are contraindicated for incisors and premolars. For molars with inadequate walls, an adhesive endocrown may be preferred over a post and core. Occlusal and parafunctional considerations. Ensure stable centric contacts and no heavy lateral or protrusive contacts on the compromised tooth. In bruxers or heavy grinders, reduce the cuspal inclines or provide a protective occlusal scheme. A rigid, long post in a bruxer can concentrate the stresses and risk fracture, whereas a flexible post can absorb some load. Consider a night guard if parafunction is present. Remember, parallel posts produce less stress than tapered posts in loading and are generally safer. Post versus no post decision. If ferrule is greater than 2 mm and more than 3 walls remain, proceed with bonded core and crown, no post. If ferrule or walls are deficient, plan a post-supported core. Note that placing a post sacrifices additional dentine because it weakens the root. So use only when necessary. Remember, longer ferrules dramatically increase the fracture resistance, whereas the post material itself has little effect on the strength. In other words, focus on creating a ferrule and conserving the tooth. If no ferrule is possible on a molar, an endocrown may yield similar or better outcomes than a post-core crown.